Good evening and welcome to this November 25th, 2024 City Council work session. Thank you for joining us in this hybrid meeting format. For work sessions like this one, where there is no opportunity for public comment, those wishing to access the meeting can do so by watching the live stream available on our website, the broadcast on Comcast Channel 21, or by calling into one of the phone numbers listed for this meeting on the public webcast and meeting materials web page. And just, we have all of our first responders here, but just in case of an emergency, I will point out that the AED is on that wall, and the emergency exits are the double doors in the back and the glass doors on the side. And, or we'll just follow their instructions, exactly. So thank you again for joining us, and with that, I call this meeting to order, and I will turn it over to the city manager to introduce the topic.
Thank you, Mayor. This is was actually kind of the third topic we've had on mental and behavioral health issues. This one is a panel, and I'm just going to turn it right over to our Assistant City Manager, Christy Hammett, to introduce our panel.
Very excited to be sitting here with all of you tonight, Mayor, Council, and of course, Chief Caven, Chief Skinner, and Judge Gill. Our esteemed panel this evening that's going to share some information, and then they're going to leave a lot of time for questions and discussions and bring you up to date on some of the emerging and urgent issues and talk a little bit about some of the gaps within the system and how their services are experiencing the system. All right, this slide is a little bit familiar to you. It's the Oregon Behavioral Health Ecosystem. And so as we shared last time we met with you, we're going to be really focusing in on what's happening at the local level, specifically the services that all of these folks are providing. So with that, I'll turn it over to Chief Caven. He'll get us started.
Making fun of Christy. Mayor, Council, thank you for the opportunity to continue this important conversation. As the Assistant City Manager said, one of our directions tonight is to provide just a brief overview of what we're experiencing, seeing, and allow more time for you all to ask questions about our services, both unique and integrated. So with Chief Skinner and I here, it might be hard to free up words for you all, but we'll try. So in Fire and EMS, and the way we've kind of looked at this discussion as we continue it is, what things are we doing that we're used to seeing, and how have we evolved to meet a changing community need, but also innovate to kind of solve some of the problems that we saw surface with the closure of University District Hospital, access to care, distance to care, and some of those things. So when we think about the traditional services that we provide, first response, EMS, fire crews, and advanced life support, and in recent years, a basic life support program where basically you call 911 if it's not a crime and you need help in some way, you send the fire crews out, and we'll figure out what your need and how to navigate towards that. The squad has found itself into that traditional response space as a different tool that we use during peak demand periods that can focus on a bigger geographical area to take pressure off of the system. When we think about how we've been innovating and how we're looking to innovate going forward, CAHOOT's obviously a long storied program in our community that has served a need and evolved with the community in a fantastic way. To in recent years when the county is obligated to provide mobile crisis services, and we're really starting to see those stand up and find their way into the community to provide that important kind of crisis level service. As we think about what's coming up for the fire department in innovations, the advanced or alternative response unit, which pairs an advanced provider with a paramedic. This was a direct result of legislative advocacy in the wake of Peace Health closing their ER in downtown Eugene. The fire department is partnered with Peace Health to deploy that unit out of the 12th and Hilliard campus in a 2-mile radius. We have just completed our recruitment phase for that, and we'll see that unit go in service with 2 of our staff in mid-December, kind of filling that critical lower acuity primary care on the street service, while Peace Health kind of finishes their recruitment to partner that nurse practitioner or physician's assistant with them. And then the concept of mobile medical response, which kind of bridges the gap between basic medical care and the 911 system or the alternative response unit. And that's a function where the county's kind of leading that way, providing a provider-based unit on the street in various locations throughout our community to improve access. When we think about what's emerging for us, or how do we evolve and take that next step to not only manage the call load, but really triage it and make sure that we're doing everything we can to provide the right resource at the right time in the right manner. Nurse navigation is a big component of that. I know you all have heard a little bit about that. We received a grant from Peace Health last year to help begin funding that. And we also applied within the legislated money from House Bill. Ethan, can you help me? What bill am I thinking? Whatever. Anyways, the innovation fund that came from the closure of the hospital. The outcome of that, though, is they had to pull back from our area and focus in the Portland metro area and other places where their parent company owns the ambulance service. So we should see that become available to us, hopefully within the next 12 to 18 months. Senior response units, another way, just freeing up capacity in our system. Doesn't directly hit the behavioral health and substance abuse issue, but it's finding ways to create capacity in the system so our units are available to respond to those calls. We just learned last week that we received grant funding from a legislative concept to fund a program to respond to those calls 7 days a week with a crew of 2. So. Community response unit, you've heard about that before. That was a concept in the community safety payroll tax. As that evolves, is bringing effectively community paramedics to the scene in our community that help prevent the calls for service and follow up with your at-risk folks that may be at risk of medical issues or overdose because they don't have access to that continuity or that continuing care level. And then FireMed Plus, which we've talked about at length, is just a tool to improve your membership to that program. What do you get out of it? Is there preventative things that we can do, again, to try to limit the almost endless growth in calls for service? So when we think about our traditional services, they've served us well for a long time, but we know they're not the right resource for these calls. And whereas, when we're talking about the proposed fire fee, right, is we're looking for resources to address the capacity that have grown 40% over the last 10 years. And so we pivot to those to our, next slide, please, to our innovative services. And in the spirit of this conversation, this chart just focuses on behavioral health or calls for service that either are determined by the dispatch center or the paramedic who provided care as a behavioral health crisis or a psychiatric issue, and then overdose calls. And so it's almost 2,500 calls a year that our crews are responding to that have some continuity to the behavioral health system and access to resources, and again, the safety net that keeps them out of the hospital or more acute care settings. Next slide. You've seen this slide before when we think about, again, directing our resources to the right place. And this continues to grow. I think from when you saw this 2 years ago, it's gotten more expansive when we look at not only the evolving crisis services that exist, but telehealth, the nurse navigation and how that's able to filter people to services that, again, don't require sometimes even a 911 response from emergency services. And other times providing an alternative transport option for our community members. Because many of them utilize the service because they just don't have any other way to get to the emergency room or to crisis versus a transport to the ER, and then the ER trying to manage that and getting those people to some type of definitive care. Again, I won't go into great detail on this. You've seen this before. It's just a reminder of exactly how the nurse navigation system works and the options that we're able to provide. And this is where why we pivoted from a concept that's probably 5 or 6 years old now within our community of a nurse in the dispatch center or nurse helpline. This really helps triage people to the services that exist in the community. And part of establishing that program is spending 90 days with our team and service providers in the community to understand if somebody calls with this issue, how do they make sure that, one, they're stable, and two, that they're able to direct them to those right services and they have a space for them. Because what we know, whether it's behavioral health or substance abuse issues, is there's a direct connection between physical health and access to physical health that is impacted by your behavioral health. So it really does help direct people in that place. And is this the slide, the next one that got, this is our last one? Yeah. And so when we think about the things that we've done and the new resources that we have out in the community, there's still gaps. There's still questions to be answered of how do we get long-term stable access to care, whether it's healthcare or behavioral health services, to where people aren't stabilized and then put back into the exact same environment that exists today. So we see some of those emerging through other programs. Stabilization Center, the potential inpatient facility that Peace Health has been discussing. All of those things need to happen for us to stabilize the safety net that is 911 and the EMS system. Just to close with, as we think about what the community's need is and how we have evolved to that, the division responsible for this is just titled Medical Services. Overseeing alternative response, emergency medical services. There's a whole suite of things that we need to be a party to make sure our community is cared for.
Mayor and Council, it's a pleasure to be with you here today. For the record, I'm Chris Skinner. I've been your Chief of Police for over 6.5 years. How time has flown by. First order of business is apology. I wish I would have been here last week for a really important discussion around community safety payroll tax, and for that I apologize. I know there was a lot of questions that maybe didn't get answered, and so just know that I'm available to you to get those questions answered as we move into the future, and we will not be missing those opportunities in the future. So thank you for your grace on that. We're going to talk about traditional, innovative, and emergent police services, and some of these are very well known to you, and some of these are maybe not, but it's probably not a secret as we see behavioral and health issues show up more prevalent in our community. They're more outwardly seen by our community members that we in the police department have to take two things into consideration. One of those things is the prevalence of crime and the instances where somebody might become a victim of crime. That's certainly a metric that we're paying attention to. It's often seen in our UCR data or the NIBRS, which is the National Incident-Based Reporting Statistics, where it gives you a propensity of being a victim of crime based on the type of crime we're seeing in the community and how prevalent it is. The other piece of that puzzle, though, is the perception of crime and what feels safe for people, or in this case, feels unsafe for people. And oftentimes, some of the people that are exhibiting behavioral, emotional, and mental health issues have a tendency to be acting in a way that many feel is an unsafe environment. And we hear that a lot from people, and so we'll try to pay attention to that. And as we've tried to emerge this police department out of responding to those calls for service where a police officer is not needed, we do know that we still have room in that space that we have to show up. And in many of those things, we show up in this traditional way where you think about officers' responding to calls for service, both officers and your community service officers doing that. Our 911 call taking, that often is the conduit by which many of these calls for service come in that we have to triage and determine an appropriate resource for the need, depending on the information that we have. And then two of the mechanisms within the police department that show up oftentimes from a traditional perspective is crisis negotiation, where there's a safety component coexisting with the mental health component that we feel like we're the best equipped to handle because of that safety component. And in some cases, special investigation unit, where we have somebody or a few people in our community that are engaged in really dangerous behavior as a result of a mental health condition, that we have a special investigation unit that's able to take that on as a case and be able to pay attention to that and try and identify a strategy on how we can keep the community safe and that individual safe. Our innovative services, the downtown co-responder team, we'll talk a little bit more about that in the future or later on in this presentation. We're really excited about what's happening there. And the housing support officers, which are two officers that are carved out of patrol that lend support to our NSOs, which is our neighborhood service officers, and our public space or public right-of-way cleanup teams as we provide security for them as they're doing their important work. And then, of course, our park officers that are a part of that initiative where we have two officers assigned to parks that are also coming into contact with a lot of individuals that are suffering from mental or behavioral health issues. And then our emerging trends and emerging strategies are the expansion of the co-responder model. Of course, the Lane County Deflection Program affects us, even though that's not our program. It's an important program that affects us and provides for a off-ramp, a really important off-ramp for people that we're seeing that are suffering from substance use disorder. And then, of course, the Lane County Stabilization Center, we're really looking forward to what that campus would look like, and will have a profound impact on the work that we do. And I don't want to miss the opportunity, most recently with Lane County Mobile Crisis, and as we expand that program, being able to have them be able to respond to mobile crisis. Next slide, please. This looks at a snapshot of some of the traditional things that we're doing. What you're looking at here is a graph of calls for service that are responded to, and you'll see the highest three calls for service that have some connectivity to mental or behavioral health issues there. And you can see the amount of calls for service that we respond to and that Cahoots responds to specifically to those three highest calls for service. But the really important metric here is the one that is on your right, which shows what we call our police officer holds, which when we go and we determine an individual is a danger to themselves or others, that we're able to actually take custody of that individual and transport them to the hospital for help and or detox facility. And that's 238 total of the calls, of all the calls we go to are police officer holds. So you think about every 36 hours we're taking custody of somebody and trying to get them help. The piece that is not captured in here is the amount of time that it takes for us to do that, from the time of arrival to triaging to stabilizing that individual, getting them in custody and safely transported to the hospital, and then the amount of time that we're waiting to be seen at the hospital. We're taking an officer off the street for hours for each one of these police officer holds. And so it's not just the number 238 may seem really low, but when you think about the overall effect of the amount of time that it takes for us to service these calls for service, it can be significant as we're doing this every 36 hours. Next slide, please. Certainly a lot of innovation going on within the police department as it pertains to behavioral and mental health. One of those is the downtown co-responders. This is an idea that was born out of the last biennium budget cycle, where we wanted to approach something different downtown. Sometimes greater sense of safety doesn't always mean more policing. And this is a great example of how we have a partnership with Lane County Behavioral Health and have a co-responder embedded within the downtown team and a co-responder officer. These two individuals work throughout the week walking around downtown. Oftentimes we will pull them out of downtown where there's a need, but they have an opportunity to engage with a variety of individuals and try to get them stabilized. We recognized, and especially in the downtown core, as a pilot anyway, because we believe that this is expandable to all of Eugene, is that if we can address some of these mental and behavioral health issues and get people stabilized, then I think it brings a greater sense of safety to people that are in and around the downtown for this co-responder team. And some of the statistics are really interesting when we think about the number of people that we've engaged here. You know, just from April 16th, 24 through August 16th of 24, we have got a number of people. The number for us is 167 last count of individuals that we've engaged in with downtown. But what's interesting is 89% of those individuals are not accessing services when we contact them. And of those 89%, 53% are refusing services. So we're happy to serve the 43% of that 89% that want services. The beauty of the co-responder model is Jose, who's our co-responder, is directly attached to the county and the FIT team, which is the Forensic Intensive Treatment Team, and we're able to use those services and bring those services to those people. We see a lot of people downtown that we contact multiple times. Somebody says no one time, but on the 15th time that they say yes, then it's worth it. So we just keep trying and keep offering services and hope that people eventually avail themselves of the services. Next slide. The housing support officers and parks officers, this is something that we feel is somewhat innovative, especially the HSOs. They respond to illegal camping complaints and immediate public safety concerns related to unhoused individuals. These guys have specialized training and trauma-informed responses, understand the complexities of the unhoused status and how to work and connect individuals to getting stabilizing services. And so they're really, really gifted at being able to do this work. And they provide a tremendous amount of overwatch and support for the other parts of the city that are engaged in this work. As you can imagine, in some cases, those folks that are doing that work don't feel like they're equipped to handle safety issues, and so it's important to have our housing support officers there. And then, of course, our park resource officers deal with the multitude of issues that we see within our parks that we all hear about, and that is an important job that they do and work that they do. Covering the amount of parks that we have is complicated and difficult with two individuals, especially when you think about the things that come up in our lives, whether it's family leave or sick or injury or vacation. We don't cover that as robustly as we'd like to, but with two parks officers, we do the very best job we can. Next slide, please. Some of the emerging stuff that we see is the expansion of the co-responder program. The Bureau of Justice Administration just awarded us about $550,000 worth of grant money, which will be able to add a second co-responder team to the downtown core, as well as a peer navigator with lived experience that we're hiring for. Actually, the county's hiring for that with our assistance. So it'll be a very robust team, and again, I think it's something that could be, if successful, could be a model for other areas of Eugene. And I would point out that we have not been so strict as to say that downtown is the only place they can work. There's been many times where we have sent them other places in Eugene where we've seen some challenges and struggles, and we see that their skills will be really valuable. We'll send them anywhere that they need to go, but the home base is downtown, and there's plenty of work for them downtown. And I love the concept of them being on foot, walking around, connecting with people where they're at. They get to know these individuals, get to know their stories, and see if we can continue to ask whether they want to be connected with services or not. The other one is the emerging the deflection program is a result, as you know, of House Bill 4002. It took effect September 1st when House Bill 4002 created an unclassified misdemeanor for possession of controlled substance. That misdemeanor, once again, allowed us to make, when appropriate, custody arrests, but Lane County embarked on a very ambitious endeavor after receiving grant funds from the state to build a deflection program with certain criteria that our officers are choosing to deflect. Now, 4002 created an environment where that is officer discretion, but I'm happy to say that we're deflecting as many as we can that fit the criteria and are moving into that system. As of last count, we have about 30 people in deflection program right now, and your Eugene Police Department is the lion's share of the input for that deflection program and the lion's share of the of the contacts that we're making for people that are in possession and or using controlled substance on the street. It's a little too early to see whether or not the deflection program or House Bill 4002 is going to be successful. As I've mentioned to anybody that's willing to listen to me, it's only going to be as successful as on-demand treatment is made available. We can certainly contact individuals, we can get them in deflection, we can get them pre-justice system deflection. Post-justice system is considered diversion, so we want to be in deflection and in close proximity to those folks being willing to do that, find residential treatment or on-demand treatment for those individuals. And so that is definitely a investment that we're going to encourage on a state level for the state to continue to make is on-demand treatment. But we're really encouraged about what we see in deflection. Officers are embracing that concept. They recognize that part of public safety is making sure that fewer people are suffering from substance use disorder. I believe that the fewer people that are suffering from that disorder has a positive impact on our crime numbers, because so often those are tied together with regards to survival, what I call survival crimes, where people are engaged in lower level criminal activity to support that particular addiction. And so getting them well, I think, makes us safer as a community, and so we're committed to being able to do that. Now I'm going to hand it off to the esteemed judge, Your Honor, Greg Gill.
All right, the red light is on. Mayor, Council, thank you very much for having me. It's been a little while since I've been here. This is my first time in this chamber, and it's fantastic. So the result really of Chief Caven and Chief Skinner's good work and their folks' good work in the community oftentimes and many times results in criminal charges against somebody who is involved with these activities that the chief just described. So they end up in the Eugene Municipal Court system. Traditionally, your system was an arraignment, and then someone would probably be appointed an attorney if they couldn't afford one to represent them. And then it would go through the process of having an investigation period, talking with the city prosecutor on potentially resolving cases if it goes to trial, prep work for that, and then it would resolve, right? And then that is the open and the close. That, I'm not sure, has happened on a regular basis for decades. And primarily, that's because of the behavioral health uptick, especially in the last 10, 15 years in the city of Eugene. Almost all of the folks who come through our system, walk through our doors, or are in our jails, suffer from some sort of behavioral health disorder, whether that's just substance abuse, whether that's absolutely mental health problems, a combination of the two, or other matters like trauma and the result of being unhoused. So the idea of splitting up the court services into this traditional, innovative, and emerging was kind of an interesting exercise for me because they all sort of bleed together since my time here with the court. The traditional model is what I grew up in, whether it's circuit court, municipal court, other courts. And so that's sort of what I know, what everybody knows as your basic civics lesson. But absolutely necessity has driven the innovation of the different dockets that we have in the municipal court, the way we receive the crimes that are filed by the city prosecutor's office and the defendants that are attached to those charges. And it became pretty apparent quite a while ago that the good old traditional model, business as usual, was absolutely not working because recidivism was still through the roof. Because our jail, folks would be in, folks would be out. They would be back in before one of the officers was done writing the report on the first go-around. And it was very apparent that substance abuse and behavioral health, other behavioral issues were at the root of a lot of what we were seeing. And so some self-preservation on trying to make sure that we could figure out how to handle this number of cases, this number of charges coming through the court, but then also trying to figure out what the underlying issues might be, what the court can do to help, because that's the right thing. So the innovative dockets and models that we came out with from traditional are courts that you've already heard about. You've heard about it from me, from other folks. The oldest of which is the the mental health court, started by Judge Mary Morey a long, long time ago, sometime before 2010. And then the follow-on community court docket, and then what's evolved into the 370 docket, and I'll explain more in that And then most currently, our opportunity docket. And the one silver lining from those folks who are in jail during the pandemic is how we treat our in-custody docket on a day-to-day basis. Some of you have been there and watched our in-custody docket, so you've been able to see that in action. But I absolutely included in my list of innovative approaches that municipal court has taken. Next slide, please. So I want to make sure that we keep this in context as we move along, right? It's really great to talk about dockets. It's really great to talk about what we're doing as a municipal court and as a city for those folks who become criminal justice involved, right? But to make sure that we understand how poignant it is that the city is actually doing this, we have to start talking and thinking about numbers. So every year in our court, just something south of 5,000 misdemeanors are filed, right? It ranges, 4,500, maybe a little bit closer to 5,000. But those are the total number of misdemeanor, the number of crimes that are filed in our court. Now, some of these are potential felonies, but the officer has cited it, not including some of the felony charges. Sometimes the DA's office has rejected these, saying, no, we're not going to prosecute this. The vast majority of these charges are these low-level Eugene Municipal Code misdemeanors. And so we have to pay attention to each one of these folks that come through our court, and it's going to be important that we keep a hold of that number. In 2023, 4,836, so let's just use that. Next slide, please. So, as I said before, behavioral health issues are pervasive in our criminal justice system here. Most every person that comes through is touched by some behavioral health issue, right? Whether it's directly, whether they're suffering from a hardcore mental health issue like schizophrenia, acute bipolar depression, anxiety, or if it's more of a tangential piece, one way or the other, somebody is going to be affected by that. And it directly affects their participation in the criminal justice system, right? From the point of being arraigned all the way through the system, whether they can be involved with their own case, whether they actually are involved with their own case, whether they actually appear in court, whether they're going to fail to appear and end up back in our jails, whether they can work with a defense attorney to walk through their case and so they can do a resolution that's going to be the most appropriate. The folks that we see a lot are folks that have been through the system a bunch. These are folks that don't necessarily care whether they have a conviction. They don't necessarily care whether they go to jail, right? These are the folks that Chief Skinner and Chief Caven's folks are working with on a day-to-day basis, and that's really hard to do. Some of these folks are what a state-certified evaluator would proclaim to be unfit or not having the capacity to actually stand trial, and so their cases are stopped while we go through a whole different scenario of trying to rehabilitate and so they can stand trial. Needless to say, this effect of behavioral health has a lot is tied hand in hand with our jail capacity. We have 15 beds in Springfield, 15 beds in Lane County. And so the idea that we have a lot of folks who are not in custody that probably should be in custody also bears proof that we need to make sure we are as innovative as possible with our dockets. So that is a long preamble to next slide. So this slide shows, and I'm going to give credit to, I have to give absolute credit to Christy Douglas. She's one of the supervisors at the municipal court putting together these numbers and this data with these graphs. It's fantastic. There's a lot of information packed in just this simple slide. You're going to see the number of incoming misdemeanors for each year, starting in 2019, coming through current in 2024. And then the outgoing. So the outgoing means that there are cases that are resolved, charges that are resolved in our court. The dark blue on the bottom are the number of charges that are now becoming emergent in our court. So what does that mean? So let's just look at 2023, right? That's right next to 24. You'd think that's pretty evenly matched, 9,391 charges being introduced and 9,151 charges leaving the court in that year. But that couldn't be further from what's really happening, all right? Incoming cases are not just new arraignments. These aren't charges that are just simply being filed. These are folks who are coming in off of warrants that are caught either in the jails or have appeared in front of the court to ask that their warrant be recalled and get their case back on track. These are folks who have maybe entered a diversion or deferred prosecution where that's failed and now they've gone to sentencing. Or maybe it's a case that's in probation, but they've potentially violated their probation and so now it's back in front of the court. So let's go back to that idea that there are a little bit south of 5,000 misdemeanors filed every year. You look at this number of incoming of 9,391. Those are all additional matters, right? These are all matters that the court has to be ready to receive, right? And it's awesome that it looks like it's fairly balanced, but you have to be really creative and you have to know effectively how to move cases forward in order to gain this kind of stability with incoming and outgoing. And our specialty dockets are what's helped us do that. Next slide, please. So those specialty dockets you've heard of, community court, our mental health court, what we now call our opportunity docket, previously known as the problem-solving docket, a little bit different. Our 370 docket, those are the folks who have been evaluated and they can't stand trial because they don't have the capacity to proceed. But now I've also included that in-court staffing piece that I referred to earlier. I'm going to start with quickly describing each of these, and we can talk about more specifics later. But I'm going to start with the in-custody staffing. This was that silver lining to the pandemic that we've continued to carry on. At some point during the early stages of the pandemic, we were no longer able to talk to folks at the jail. We were no longer able to see folks who were in custody at the jail. We had to do this remotely, and so from the courthouse, we would see defendants. They would have access to their attorneys, but basically they would be at the Lane County Jail, and we were at the Eugene Municipal Courthouse for that separation. One of the things that we did for efficiency's sake only back then was to talk about all the cases before they actually appeared, because it became very awkward for an attorney to appear and for argument to commence virtually. It just wasn't working, especially with a fast-paced jail session. So now we staff all of our cases before they go live. We hear some argument, but it moves it really fast. What that means, though, is that during the staffing, there is an actual robust conversation about what happens with each person who's on that docket. So it's not a formal process where someone stands up, their case is being dealt with, and they move on. Their case is actually talked about. This is important because defense attorneys have almost real-time communication with Lane County Behavioral Health, with other service providers, whether it's Laurel Hill or Center for Family Development or other folks that they might be in communication with. And city prosecutors can talk to victims either present or real-time talk to them, or email with them, communicate with them, so we can actually resolve and move our cases forward in a way that actually makes sense. That's really important because, like I said, the vast majority of the folks that we see suffer from a behavioral health issue, and so solving what the next step is going to be is kind of hard to do. So staffing is important. Our opportunity docket is newer. Those are hard cases. Those are cases where someone might be already working with somebody in the community, a provider, and we want to keep that relationship going to potentially get their case resolved that way. But it's also very important because we've connected with the FIT team, as the chief explained, the Forensic Intensive Treatment team. And those folks are on site at that docket, trying to connect defendants directly with folks who might qualify for the FIT team, which is an extraordinarily important connection to make. And we can talk about the FIT team as we move forward as it's relevant. But the opportunity docket has been borne by these really hard cases. They're really hard to solve. The community court, you're all familiar with. That's basically geographic areas, qualifying crimes, low level, and the idea behind that docket is to connect folks who are charged with these crimes with local service providers and try to get them out of the criminal justice system by getting them connected with the folks that can help them the best. And then our 370 docket. Those are our folks who have been evaluated and they're not fit to proceed. And so they either are rehabilitated at the Oregon State Hospital or attempted to be rehabilitated there, or they're to be restored in the community. That means working with local service providers, primarily Lane County Behavioral Health, to try to rehabilitate so that they do retain capacity to proceed. Next slide, please. So community court, I'm not going to spend a whole lot of time on these slides, but there's information here of folks who have participated in our programs over the last few years. You can see that there's a huge downtrend during the pandemic, and we've really tried to right-size ourselves as we've progressed through 2022, 23, 24, and it is becoming very apparent that a lot of our service providers are still very involved. It's important because most of those service providers have a huge behavioral health component, and so again, trying to connect folks with behavioral health needs, those criminogenic components, with local providers. Next slide, please. And so the same thing with the, what we call our 370 program docket, but these are folks who aren't fit to proceed, working primarily with Lane County Behavioral Health. What I wanted the council to see here is this uptrend of the number of folks who are found not able to proceed, and so their cases are stayed. These are folks that not only suffer from a behavioral health issue that incapacitates them, right? These are all substance abuse as well, these SUDS folks. And whether these things are born from prior trauma, being unhoused, or something that's organic, is a case-by-case basis. And so they receive treatment. Hopefully, they can be restored. Right now, our court has 16 folks at the Oregon State Hospital, and we have a total of 81 charges who are currently in this program. That doesn't include folks who are also with Circuit Court or with Springfield Court or other courts throughout the state. Next slide, please. This is an example of our mental health court program. The mental health court program works directly with Laurel Hill, and in that provision, it's the mental health component as well as working with a SUDS component. What I'd love to call dual diagnosis, but it's really not that. It's working with Emergence and Laurel Hill, but it's basically connecting them with providers that can help them, and if they continue to work with the providers over a 6-month period, they can have their charges dismissed. It's very successful connecting them with that stability. As you can see, the vast majority of charges last year and this year are dismissed, which means that they were successful. So we have those dockets that have been innovated over the last 5-10 years to deal with the issues that come into the Eugene Municipal Court. Emerging, however, is just the continued need to make sure that we refine and develop. The first big piece is with our community court. One of the big challenges for someone to navigate these systems is the need to sleep, the simple need to eat, the simple need to have one place where they can be. And so the community court got a grant from the Bureau of Justice Assistance to actually reserve 16 to 17 Conestoga huts, the ones that you see around here that are run by community-supported shelters, and actually house those folks who have the highest needs as fast as possible, or not house, but to give them shelter, so that they can get sleep, so that they can eat, and so that really helps them navigate the system with the idea that it gets them to more stable place where they can obtain more stable housing, or housing in general, as well as continue to work with these other service providers. The emerging pieces within our dockets, all right? The first one is working with other courts. There's 370 dockets. Believe it or not, Eugene is not the only place that has folks who are found unfit to proceed, right? The city of Springfield has the same uptick. Lane County has the same uptick. Lane County is also known in the state of Oregon for the number of folks who are found unfit to proceed and putting a strain on the Oregon State Hospital. Not because it's what Lane County wants to do, but it's because the vast reality is we have those folks here, and that's how we're working with them. You've heard before, you'll hear it again, the city of Eugene is a mid-sized city that has really big city problems, and all those city problems funnel their way through the municipal court. And so the result of that is that we've increased our connection and collaboration with Lane County Circuit Court as well as Springfield Municipal Court. So everybody has eyes on what's happening with these defendants who are shared among all the courts. And so these services aren't redundant, but we also know where people are and what kind of help that they are getting. Other partner agencies. This goes back to what was being referred to before. The coordination piece with all of our specialty dockets goes up with the advent of the deflection program as well as the stabilization center, and then continuing working with FIT. The deflection folks are going to be the same folks as our folks. The only difference now is that those folks are charged with a substance abuse, or I'm sorry, a controlled substance violation that's qualifying. The DA's office doesn't get into it yet, and those folks are receiving direct services like they would through community court. But as drug charges aren't allowed through municipal court, this deflection program has a huge potential to make a big impact. But again, community court folks, other folks are working with municipal court. They're going to be contacted by law enforcement and potentially be a part of that deflection program. So we need to make sure that we coordinate so we're not asking someone to involve with redundant services, different programs. Same thing with the stabilization center. A lot of our folks are going to be the ones who will be in the stabilization center, and so we need to make sure that we're coordinating with those folks as well. I believe that is it. The next emerging piece The behavioral health resource networks, those are the advent of Measure 110. A lot of our local service providers have already been working with municipal court even before they were recipients of the 110 money, creating the burns. But a lot of those burn members are now a part of our community court program. Laurel Hill Center for Family Development, Emergence Shelter Care, HIV Alliance, Looking Glass, Restored Connections Peer Support, Whitebird. All of these folks have already been at the community court as part of our provider room, right? And so they get this 110 money. It's fantastic. So our continued coordination with them through our courts is going to be extraordinarily important. And then the jail and healthcare staff. The Springfield Jail now has the same health coordinator as the Lane County Jail, and so the share of information on the folks who are in our two silos has been vastly improved, and so we can keep track of real time whether someone's taking their medications, real time whether someone is experiencing another behavioral health issue, real time what's happening with someone's health, whether they even have a prescription. What do we need to do with this particular one person? I'm not sure if I blasted through the 15 minutes. Maybe I hit half an hour. I'm not sure. But I tried to get in as much as I possibly could as food for thought. There's a lot to talk about. I appreciate it.
Great, Judge, thank you. Just a quick reminder, as Intergovernmental Relations Manager Ethan Nelson shared when we spoke with you at our last session, was that we had a lot of different things that were slated for legislative process discussions. The next one will be December 4th, which is an IGR committee meeting to finalize state priorities, and then sometime in January coming back for a council work session on these topics. And with that, we're done. Back over to you, Mayor. Thank you.
Okay, thank you very much. That was a lot of information to walk through. Fortunately, it's not the first time for lots of those pieces for all of us, but I think it's striking how, I think as the community, we sort of lump all of this stuff together, right? I mean, as community members, we don't see all of these different, either in the EMS system or in the police system or in the court system, really sort of understand how nuanced it is and how targeted it is and how specialized some of these teams are. So it's pretty awesome and also a little hard to track, I'd say, for all of us, of sort of keeping track of how these different pieces work. So I really appreciate this panel presentation of bringing it back again to us. And with that, I'm opening it up to the counselors, Randy and then Lindsay.
Thank you, Mayor, and thank you to the four of you for being here today and walking us through this. And this may be the third such session that we've had, but I still feel like we're just scratching the surface. And I'm always looking for how can this council be more effective in helping you do the work and get it done. But before we kind of get into that question, hopefully that just kind of runs through everything I'm asking here. I know the most about fire because that's where I came from. So I probably have the fewest questions for you, Chief Caven, just because I'm pretty familiar with the good work that you do, and I sure do appreciate the innovation. I have kind of a general question to lead this off. How effective have the permanent supportive housing facilities been? I'm talking about the Commons on MLK and the Nell down on 11th and Charlton.
The thing for us, albeit it's a driver, it's a high impact area for our downtown Station 1 crews that have to respond there. What we've found is we know where they are accessing care from one place, and the efforts can be put in to try to move them to that next phase. Obviously, it's been I think a growing experience for them and the service providers on really how to work with the rules and the people that are there. But for all intents and purposes, the ability we have to track how often they're accessing or those individuals are accessing the 911 system from that facility are less than the amount of time we were seeing them out in various spaces throughout the community. So there is value to having them co-located.
So there's a net gain, you would say, by having the facilities?
It's not an amazing or an exponential change, but there is a gain to that.
And for my colleagues, these are people that you see sometimes multiple times in the same day. And you don't have to remove many of them off the street into a better situation that helps them, but also frees up capacity to be dealing with other problems that are out there. So that's incredibly important. That was in the planning and construction phase right as I was retiring. So I didn't really get to see that implemented, but I had heard that basically it just changes the location of the call. So anyway, that's good to hear that you think it's a net gain. I also had a question about the 238 police holds. Chief, do you have any kind of sense of how many of those are repeats?
I don't for you today, Counselor. What I would say is, in my experience, that very few of those end up being repeat people just because of the acute nature of the care that they get once they're under police officer custody. Now, I'm not saying that we don't have repeat people that we see, but I would venture to say that not the majority of those 238 are repeat calls for service for us where we are continuing to POH somebody over and over and over again.
That's good to hear. I appreciate that. I did have I'm out on the street a lot myself. I just go out because I try to keep a handle on things. I did have an opportunity today to observe two of your officers, and I don't know if it was Parks and Open Space staff or Public Works, but they were at the overpass over the Amazon at, I believe, Sam Reynolds Street. And I was amazed at the patience and the professionalism which that departmental group were exhibiting, and they're trying to address a congregate camp that had established under the within the 100 feet of high bank of a waterway. But it was just really interesting to watch that, and I walked away very appreciative of how they approached the problem and how they handled it. And I've watched our housing officers, our parks officers, our parks staff, our neighborhood services officers, and our firefighters all interacting in this space, and they do an incredible job. So I appreciate our people on the street, but I also appreciate the leadership you all are providing. And with that, I'm out of time, and maybe I'll ask for a second round, Mayor. Thank you. Thank you very much.
Okay, thank you. Lindsay and then Matt.
Thank you, Mayor, and thank you all for being here and for all of the work you do for us in our community. I probably will need a second round, but I do have a first round of questions, one for each of you. Chief Caven, the Cahoots was housed in our EPD, and now it's housed in your department. How do you feel like that's going? I know we had received a huge, analysis evaluation, and we're all, I think, concerned about response times across the community. And how do you feel about that, and what would it take to vastly improve the response times for that program?
So, somewhat of a challenging question to really kind of wrap around and get the perfect answer to. The transition was good. I think it was at a time where some change or just different set of eyes were helpful, but at the same time, we saw Whiteboard as an organization start to navigate through a lot of changes themselves, and how they show up into that space, the early phases development of the Lane County mobile crisis, and whether Cahoots is the provider for that or not. And so there's a lot of change that occurred, not just the transition of that contract to the fire department, but also within how Whitebird structured the service levels that they're going to provide, how to navigate the callers in the 911 system to the right component. And so I think right now when we think about strategies, I know that Cahoots is still or Whitebird is still evaluating how to bring Cahoots up to their kind of the full certification required to operate in the statutory environment for mobile crisis response, but at the same time We have to make sure that the right calls are going to the county. One, not only because they have an obligation to respond to those, but also to ensure that they're getting the right calls to stabilize their own funding and really growing into what they've committed to do. And so I think the first phase is really understanding the county's full capacity to respond with MCS, what it really does, and figure out how to leverage, and let Whitebird figure out how to leverage filling in the voids, because they have a lot of intersecting safety nets, whether it's, the crisis response or just basic care, so, access to services, the connection that they have to the street. And it's really hard to unwind exactly which spaces they belong in. The one thing that has improved, Chief Heppel's done an amazing job developing, I think, a good and open relationship with staff, so that we're, on the front end of changes or concerns, but also pipelining their response data through our metrics, so that we have a dashboard to understand what they're experiencing. And we've seen, as regulations come into the space, the effectiveness or where they can do their work kind of trend downwards. And that's not one single thing. That's not just the county what can they do, right? It was very organically grown and probably over capacity or over scope in certain areas. And so we're still sorting that out long-term as they sort out the future.
Thank you for that answer. And it's my understanding right now that the first phase of the Moat Bowl crisis for the county is more in the outlying areas of the county versus inside Eugene Springfield. Is that your understanding, or is it all
No.
enmeshed?
It is all within their hours of operation, which is 2 p.m. to 11 p.m. And so pretty much all first crisis calls get pipelined to the county. Coots still is a safety net for the community in the hours where that's not staffed. But if you call in crisis, regardless of where you are, the county MCS is dispatched to that call.
Chief Skinner, on your downtown co-responder program, you said, you gave a bunch of metrics on like 53% of the people who were asked about whether they'd want services declined. Can you talk more about what services are being offered at that moment and how they're being asked and how you're building trust with people to make them comfortable to get those services?
Sure. Thank you for that question, Counselor. Part of this is just the talent of that team, between the officer that is deeply compassionate about those people, but also very well trained on how to approach that. And then our co-responder from Linn County. We could have not landed a better individual whose experience comes from Skid Row in Los Angeles. And so when you think about having two of the right people that are able to interface with these folks and just have a conversation and better know their story, and being able to offer the multitude of services, whether it's housing, food, medical, the whole suite of services that Linn County Behavioral Health is being able to offer is been really, really important. One of the things that we hear kind of anecdotally, now we're always going to have somebody that has some legacy information about downtown. I hear from all the time, I'd never go downtown, it's unsafe. And then my first question is, when was the last time you were downtown? And I said, well, it was before the pandemic. And so we constantly are up against people's most recent recollection of downtown. But as we talk with business owners downtown and our incident commander, Ray Brown, who's downtown, who has been connected so deeply with not only the business, but our visitors downtown, we're starting to see some positive effects from the amount of interactions that we have and contact that we have with these individuals downtown. A lot of them are repeats in and around the downtown core. Like I said earlier, there is some level of frustration that it takes 10, 12, 14, 15 times before somebody wants to avail themselves of services. But this team, I think the persistence this team has should be commended, because they don't, it's just not a one and done, oh, Mr. Smith said no last time, we're not going to offer, we're not going to engage with Mr. Smith this time. It is a constant, we're almost a nuisance at this point to individuals because we're offering services so often in that downtown core. But we've seen that is the model in which we need to follow and just be really, really diligent about offering those services.
How are those services provided? If they say, yeah, I need food, what's the next step?
In some cases, they'll immediately connect them from somebody from Lane County that does that. Sometimes a FIT team member will come down and do this. One of the things that in the expansion model that we have, not only is it a second co-responder team, but it's what we call a peer support specialist, which is somebody that is hired with lived experience that will be able to be kind of that, I'll use the term caseworker loosely, but be able to shepherd somebody, be able to, through that, to be able to get them connected to those services. But once we get a yes out of somebody, we try to do that warm handoff to the county.
Well, yeah, I'm really happy that we're putting in some peer navigation. I was also happy to hear that these folks don't have to stay downtown. I know it's a downtown co-responder program, but we obviously have a lot of different areas in the city. How many responses have we had, say, in the Whitaker or from this particular team?
I don't have those statistics in front of me. We can certainly get those for you, because that would be interesting to know how many times we've drifted out of that downtown core to help out. It's been on a case-by-case basis when requested. It's not as a matter of course that they would just drift into those areas. So usually what has happened is there may be another officer or a city staff member that's engaged with somebody that sees that this might be a good fit for the co-responder team to come and kind of take over the conversation, and then they would reach out to them, and if they're available, they kind of load up and they come down and do that. We just felt really important. It was important to me to make sure that this wasn't just, even though the way we built it was with the boundaries around the downtown, because we were seeing such acute areas, especially in and around the library. We didn't want to not explore the opportunities outside of the downtown core and kind of test this out. And I think as we continue to build it, is something that could be beneficial throughout the city.
We have the grant that's allowing us a second team, but do you see us expanding, like you said, across the city, and what would that take? What support would you need for that?
Just time, energy, and money, ma'am. I mean, that's what it comes down to. I mean, the second team, we're looking forward to seeing what we can do with that team. It would provide for our ability to kind of go in and around downtown and expand out. We're starting to think a little bit about when we say the term downtown, what that defines now. For me, it's very much in my on the horizon around breaking away from the traditional boundaries of the downtown to be looking at what's happening in and around kind of Washington Jefferson Park, grabbing all the 5th Street development all the way to the riverfront when we start thinking about downtown. And so I think we will, with the second team, be able to show some really good numbers outside of the downtown as well as kind of a test case.
Well, thank you. We didn't touch on this, and so if you don't have the answer, that's okay, and it might be everyone. We have our opioid settlement money. I'm interested in hearing a little bit more about how that's being used for current services versus new things emerging, and how that might contribute to an improvement of our opioid addiction here in.
Councilor Leach, we have been using it, a lot of it is for one time. As you know, the dollars that are coming in, they're very sporadic. And so we're not making any long-term investments with that. But I believe we bought Narcan, invested in quite a bit of that for being used, and some other one-time investments. And so I'd be happy to get you a list of all the where all of the dollars are going that we've received. So if that would be helpful.
I would love to see that. Thank you so much.
You're welcome.
Lastly, I have gotten a report, Judge Gill, that we still have a lot of unpaid fines, and we're still trying to collect on unpaid fines from previous marijuana charges. And what does that look like in our community to get those expunged at the local level, or forgiven at the local level?
Councilor Leach, thank you. Great question. It's been a while since I've heard that, and so I'd be interested to find out in what area it became a concern, if anything comes in front of the municipal court in terms of trying to resolve former charges or former fines. Those should be gone. And so if that's been an issue for somebody, I would probably need to know that.
I got just a report probably about 6 months ago that said we still have about $1.5 million in those fines that we're still trying to collect on, and then it's not coming back to us, right?
Good.
They're
I will
paid, so thank you.
double check on where the policy stopped and the status of that and report back.
Thank you so much.
Okay, thank you. Matt and then Alan.
Thank you, Mayor. I've got quite a bit, but I want to first kick off my comments and questions with gratitude to you all, Judge Gill, Chief Skinner, and Chief Caven. And I'll hone in particular, congrats, Chief, to the 31st fire class and the 15 new firefighters who recently graduated their academy. Chief Skinner, congrats to those on your team who received outstanding accommodations from the Oregon Police Officers Association, including the Medal of Honor, the Medal of Valor, the Life-Saving Medal of Valor, Life-Saving Distinguished Service, Public Service, and Critical Incident Accommodations. So please share with your teams my personal kudos and congrats and accommodations as well. I'm going to start with Judge Gill. You mentioned the recidivism rate in a traditional through the lens of a business as usual model. You said that the recidivism rate was through the roof, but it has improved. What is our recidivism rate now, and when was the shift from that business as usual model to an improved model as you described?
I don't know about the actual recidivism rate, and that's actually kind of a hard number to nail down. It's really hard to get a comparison for statistics, apples to apples. But I can also get you the numbers. I'm not trying to evade the question, but I don't have that actual number or set of numbers on me in terms of what the rate is. I don't know about recidivism coming down or rates through the roof in general, but in terms of the specialty dockets that we have, as an example, community court, what we've been able to determine through the evaluation, but then just generally is that those folks who successfully complete the program have a lower recidivism rate than those folks who did not opt into the program in the first place.
Right. This is going to be a tough one, and I'm going to dance around this because it has a political nature attached to it. As the overlap of public safety and how does the behavioral health landscape, whether it's the lens of justice or the lens of public safety, change as we come out of a highly divided election cycle and a new administration that at the top of it, the incoming president has indicated retribution, both retribution politically, retribution targeting the media, and I suspect that folks' anxiety levels are through the roof. And so I would like to just hear from you at a local level, and I think it warrants possibly a larger conversation as we approach the swearing in of a new administration. What, if any, thoughts, observations, and if you could comment on if that landscape, that behavioral health, mental health landscape changes, if at all, or how are you approaching a potential federal shift, or are we just locked in with what we can and should be doing locally?
Big picture, I would say that last piece. The landscape has shifted quite a bit since I first became a judge in 2013. We've had several administrations come through. Funding sources have changed. Some have dried up. Some have become huge relative to what they were before. And each time the municipal court, in terms of what it has to offer in helping navigate someone through the criminal justice system, holding folks accountable along the way, has shifted with those changing tides. And so right now, we have our behavioral health networks, those folks who are deeply entrenched in the behavioral health world that we use as resources. A lot of those folks are extant only because of the money from 110 or are greatly helped by 110. Those folks who get OHP to be able to involve themselves in a lot of those services. A lot of those funding sources are state-driven. They're also, they also come and go. And so the easy answer to your question is we've had to do what we had to do with what we've got since the beginning. And whatever happens, we're going to continue to try to do the right thing with whatever we end up with. And so if all these sources were to dry up today, we're going to still sit around and figure out how we can best help those folks with the services that are available, with the resources that we have.
I'll get it in. You've got a policy body in front of you. Are there any policies in your respective departments or under your purview that could use some retooling or reshaping to help you all do your job better?
Thank you for the question. I'm not sure it's necessarily a policy discussion for Eugene City Council. It connects to the comment that I made about on-demand treatment. It's not a secret that this state underperforms in its investment in addiction service and mental health and behavioral health investment statewide. I would see locally here a change in our public safety, or the sense of safety in our public safety trajectory is impacted by the ability to get more people into treatment. And I'm talking about on-demand treatment, evidence-based treatment options. And so, you know, we believe that under House Bill 4002, for example, much like ballot measure 110 back in the day, we were supposed to be, law enforcement was supposed to be this vessel by which people would get help through the issuance of an e-violation. We saw that that did not happen. In this particular iteration of 4002, it's the recriminalization of certain, of hard drugs for the unclassified misdemeanor. Our sincere hope is that not only does the state recognize the ongoing investment, the importance of the ongoing investment of the deflection programs that have been stood up in the various counties, and I will say that Lane County is being seen as one of the standards and the model by which a deflection program is stood up in an area that did not have deflection. And so an ongoing investment there and an ongoing investment in on-demand treatment so that when we do make the encounters on the street, we are able to deflect people and do that with the right individuals, that there actually is a safety net for them, which is residential treatment or some kind of evidence-based treatment.
And do you mind if I just jump in? I'm going to add to that. Not only is Lane County seen as a leader, but it's also seen as fairly unique among the counties in the deflection program. The way Lane County has decided to stand its program up, the way that it's diverted or oriented the majority of its resources that it's receiving from the state is to make sure that those boots on the ground, quick connection to service providers, on-demand treatment, making sure these navigators have contact and continued contact, even in bringing in a potential housing piece to that flow, is not happening very many places in Oregon. Marion County's had a LEAD program, which is similar, that's been around for a little while, that's been very successful. But Lane County itself and its approach using the deflection program is very different than a lot of other counties. A lot of other counties are only using controlled substances. They're not including these lower level quality of life type crimes and connecting folks with services. And so for what these folks see on a day-to-day basis, being able to use that deflection program to get these folks deflected and receiving these services that quickly, that kind of endorsing that particular policy and the approach that Lane County has taken so far, I would say would fit that bill. I just wanted to add that to what the chief was saying.
And I would just add for the context, both Chief Skinner and Judge Gill, hit on is for us of the 40% increase in call volume we've experienced in the last decade, 15 to 20% on the rolling average of all of our calls are related to houselessness. And these substance abuse, behavioral health are often the root cause of that. So supporting policies that help people connect with services, housing, stability, the safety net can take them off of the street and lower the overall burden on our workforce that continues.
Okay, thank you very much. Alan, you're up.
Thanks. Yeah, I've often said that homelessness is a symptom. The actual cause is mental health issues, substance abuse issues, and lack of affordable housing, and they come out as homelessness issues. So helping solve those three problems will alleviate or eliminate the homelessness issues. But those issues have been baked for 50 years, and we're not getting doing much headway on them. Apologize for being late. I had to be in Salem. It was my assistant's last day, but I did listen to it on the car radio, and I heard all of everything that you said. And I wanted to let the three of you know you all have really good radio voices. So if you need a second career, the reason I worked with Lindsay on this work session poll was to educate, illuminate, and illustrate, and to educate us and the community about what the system looks like, and to illuminate the problems in it, and to illustrate where we are doing well and what we could do more about to help the system. But the mental health and substance abuse system is so very broken. It's super underfunded and super overstressed. It's also true that almost everybody else is responsible for it, except other than the city of Eugene. They're primarily responsible for it. Our part is kind of minor, but it does take up an enormous amount of time. At the police commission the other week, Chief, we were talking about Narcan, and you mentioned a startling statistic about how many Narcan doses we do per day, week. Do you remember that? No, and those numbers were? Ballpark.
Yeah, I'm not going to have the number off the top of my head, but we administer, it turns out to be about 1.5 doses a day over the course of the year is what I remember doing. Now, having said that, Counselor, I will tell you, as a result of some of the things that we're doing, I think it's a direct result of the co-responder program. We're at a 2-year low in overdoses in the downtown core. And so I do think we're making some headway.
Yeah, good. But it does take a lot of time. And the recidivism, they keep coming back to see you, Judge Gill, and you're responding to it, and all the firefighters and the EMTs are responding to it, and all the calls and the wall time at the hospital. And I guess one of the takeaways I take from all of this conversation we've had in the last couple of meetings is that while all that's necessary and we have to do it, this problem diverts so much time from our system and so much time from what we're doing, and we could be doing so much more other important work, because this is so resource intensive in taking away time from your 3 departments. And if we could just partially solve this, we would be able to spend a heck of a lot more time doing the other things. The second takeaway, I think, is that while we're not primarily responsible, today is a really good example about things I heard where we're doing very innovative work with creative solutions that are alternatives that work really well. Thus, what you just said, Chief. And so I thank you for all the great work that the 3 of your departments do, because it's super important for this community. And hopefully we can get around this issue and grapple with it a bit more, so we can give you more resources to be able to do the things
Hey, thank you. I know you needed a second round. Is anyone who, are you still going? Sorry.
No,
You want a second
yeah,
round?
I just have a question.
Okay. Okay, hold on. So I have Randy, I have Lindsay has another question, and then Alan, was that, you have another question as well? Okay. Okay. All right, Randy.
Thank you, Mayor. And start with Judge Gill, because I didn't quite get to you in my first round. Again, thank you for everything that you're doing. When I look around the state, it seems like we're leading the pack in innovation in our municipal court as well. And, big kudos to you and your team for the work that you're doing there. You talked about, how we use the jail and how we best utilize it. Over the last 2 years, I've had the opportunity for several jail tours with the sheriff and Captain Riley before he retired. And they showed me some people who are incarcerated out of Muni Court with severe mental health and substance addictions. And it was amazing watching people just deconstruct before our eyes. I mean, it was sad, it was scary, it was evoked a lot of emotions and reactions from the people I was with that were from the business community taking the tour. Are there things we can do to better address that beyond what we're doing? I mean, I think we're all grasping at straws, trying to figure out what can we do differently that will have better outcomes.
Counselor, that is a fantastic question. And I think the answer is yes, there's probably a ton of things that we can do, but what those things are, I think, continue to evolve. I'm glad you took those tours of the Lane County Jail. The Lane County Jail, as well as the Springfield Jail, have a lot of folks in it that are suffering, that don't necessarily belong in jail, that are only in jail just because of the behavioral health issues that they're suffering from. A lot of folks who are in jail belong in jail. They need to be there. That's part of the system. On a day-to-day basis, court staff and judges and attorneys come face-to-face with those folks who are incarcerated, who are in our justice system, and it is our responsibility to make sure that their cases move forward appropriately. So what we can do to address that person in that moment, whether they've decompensated, whether they're just back from the Oregon State Hospital, whether they're coming off of whatever drug that they may be on, maybe they are recovering, whatever we can do is what we're going to do. What we can do additional to what we have. If I had the ability to have a residential treatment facility attached to the back door of both jails that we have folks in, so when they're released, they go right into this treatment facility. They're directed to the service provider that they need, or series of service providers that they need, directed into a restored approach to being a member of the community once they're released, once they have that structure. If that was there, that would be wonderful. Because the reality is, for the longest time, that if someone was in jail and they're released, they are, they're released through the front doors of the jail. And I'm not talking about this is what happens today, but traditionally they're released, they have their bag of belongings, and when they leave, the street signs are the same, the folks who are supplying them are the same, the folks that they run with are the same, the building across the street is the same. Nothing has changed. They may have changed because they've become sober. They may have changed because they've received their medications. They may have changed because some people are actually paying attention to them. And they may have changed because they now have structure or have had structure for a short amount of time, for a longer amount of time. But once they get out those doors, they are on their own. And having that residential treatment facility, or those folks on the ground who can give that intensive attention to that one person at that one time, would probably, in my opinion, make the biggest effect on recidivism, the calls for service, the kind of, the three kinds of service that the chief was talking about, kind of calls that they receive, having to do with someone suffering from mental illness, substance abuse disorder, all of those things. Now, the Lane County Jail is doing some amazing things. They just really are, within the walls, and then in terms of releasing folks. They've got Willamette Family there, they've got Ideal Options, local medical assistant treatment folks who are right there, ready to receive for a lot of folks if they know that they're coming. Lane County Behavioral Health, to a similar degree, and the number of programs that are available through the different court systems and even the deflection. We have folks who are on the ground who have been there, people with lived experience that are really involved, getting their hands dirty to try to do that very thing. And that moment to catch somebody is when they're being released from jail. So there's no good answer. I don't have the perfect answer other than, hey, let's build the perfect building with all the service providers and everything that we need so that you don't have this return effect and where the brain and the body tell you, hey, I need to go get my whatever I had before I came in, or suffering from the same mental illness that I was suffering from before I went in. Without that piece, I think everybody's doing a pretty darn good job of trying to recognize what their status might be, what they might be suffering from, what they can do to help, and trying to sift through those folks that really do belong in jail. And those folks who are, like you described, really probably shouldn't be in jail and might be in there, but for the behavioral issue that they're suffering from.
Thank you, Judge. For all of you, and I know we're running out of time here, so just quickly, I did have coffee with Dr. McGovern from Peace Health, who's the chief medical officer, and also David Butler from McKinsey Willamette in the last 2 weeks, talking about how do we divert people from the emergency departments to free up capacity. Are we involved in the conversations on the behavioral health hospital that Peace Health is proposing to site right next to the stabilization center? And if we're not, we need to be. And that's not just directed at you, Judge.
I'm not directly involved with that, and I'm not sure anybody in the court on
No,
our
I
staff
wouldn't
are.
think you would be. I guess this is just to anybody at this table.
County has included us in many discussions about the stabilization center. I think, I don't know that we've been involved in the Peace Health.
Can somebody reach out to them? Because I think they're willing and interested in our input in that. Thank you.
Okay, I'm going to give you all a time check. We have 4 minutes, and I have 3 counselors with questions. So short answers, short questions, short answers, because the staff, 4, actually, because the staff has to change the room around. And actually, I'll pass. You'll pass, okay. And Emily hasn't had a turn, so Emily, I'll give you your first round.
Super quick, this is such an important topic to me, all 3 of you. I've been so happy to work with you. Innovative, that's an idea that you've presented, a keyword in today. It's been in your work. It's an idea that I urge people to look for and recognize. So please keep looking for innovation. It really is one of our paths to success. Thank you for continuously working on so many problems in these challenging times. And I have immense gratitude to all of you and our staff for making our city healthier, happier, and safer.
Thank you. Lindsay?
Thank you so much. Yeah, quick question is, how are we training, or how are you all training all of your staff in mental health response, like trauma-informed care or other things that make them more prepared to meet the need in the community? We talk about the right response a lot, so.
We have a really, really robust critical incident training, CIT training. We have instructors that are trainer instructors within the organization. So that is a evolution that occurs during in-service every single year. The new officers that we're hiring come already with some of that training from DPSST, which is our licensing body up in Salem, and then it continues within EPD. And so it's just it's kind of an ongoing training evolution for us.
So it's a part of the curriculum here in Oregon. Now, there's a couple hours in each recertification cycle. We'd love to have more time to be able to train, but currently with demand, we're up against trying to keep the doors open and meet the minimum standards for all of the disciplines that our staff do. But it's there as a part of the onboarding, and then again for your annual recertification, there's touch points on whether it's trauma-informed care or other behavioral health related topics.
Thank you, yeah, such a critical component. I know we're doing amazing things and can continue to do even more. So again, thank you for your service.
Thank you. Alan?
Yeah, Counselor Leach brought up the opioid settlement and asked for what have we spent it on. But can you also add to that what we have left in that settlement and what the plans are for spending that additional amount? So what we've done and what we're planning to do and how much is left.
Ever so briefly,
One
Mayor.
more.
Yes,
One more,
thank you.
Matt, go for it.
And maybe it's because many, many, many years ago, when I was about this tall, I was a police explorer cadet. But the Citizens Police Academy caught my attention, Chief. Are there any behavioral health components to the Citizens Police Academy? And could you elaborate on the academy and/or give us any details about any future open house opportunities for the public to attend?
So we're recruiting right now for Citizens Academy attendees. I don't remember the dates right off the top of my head when that's going to happen. What it does is it allows for individuals that are interested to have some experiential time with us at all facets of law enforcement and public safety here in Eugene. And so there is a component in there that goes over our crisis intervention and crisis negotiation team and their function. So there is some of that time that is able to do that, as well as some opportunities to experience through virtual reality and simulations, how we encounter people with behavioral and mental health issues and how to navigate those. And we've found it really important for people to try and put people in similar situations that we ask our police officers to be in. They get a better understanding of how complex the issues are and a more profound appreciation for the training that we go through.
Thank you. If there's an opportunity for any one of us to participate in that, I, for one, would be most interested.
You can do whatever you want, Counselor, and happy to shepherd that for you.
It's a dangerous invitation. Thank you. Thank you all. Really, such a compelling presentation. Really appreciate the work that you've done and appreciate the time you took to explain it to us and answer those questions. And thank you, counselors, for all of your questions. And with that, we are adjourned, almost right on time. So thank you.